My name is Rashi Romanoff, Vice President for Programs and Partnerships at the Elizabeth Dole Foundation. We're thrilled that you all are joining us for today's Spotlight Series webinar on accessing COVID-19 vaccinations through the VA. Just a few words about the Elizabeth Dole Foundation. We were founded in 2012 by the amazing Senator Elizabeth Dole and are fully dedicated to supporting and empowering our nation's 5.5 million military and veteran caregivers and their families. We encourage any caregivers that are on today's call to please sign up for our community at www.hiddenheroes.org. On our webpage, you'll find a complete list of programs and resources that are available to support you. During this uncertain time, EDF has teamed up with our partners at the VA and at Philips to provide veterans and their families with information around high priority topics. Our first 3 sessions focused on telehealth, whole health and self-care, and rural health resources. These sessions have had more than 25,000 views over the last few months. Please visit the EDF YouTube page to access these sessions. I'd like to give a huge thanks and a huge shout out to our partners at Philips, whose generous support has made this Spotlight series and so many other programs possible for veterans and their families. Today, we're bringing you content related to how veterans and their families can access COVID-19 vaccinations. We know that this is a hot topic for many in our community. At the end of last year, the Elizabeth Dole Foundation directly appealed to VA leaders with a direct ask to please include caregivers in their plans for veteran vaccination across the VA. I'd like to personally thank Dr. Lieberman and his team for taking the first steps towards this very important goal for our community. Last month, VA issued guidance granting local facilities the authority to vaccinate caregivers in the Program for Comprehensive Assistance for Family Caregivers, or PCAFC. We're excited to get the latest updates from our VA colleagues on how rollout is going and what veterans, caregivers, and their families can expect in the days and weeks to come. Just a couple of housekeeping notes. We have a lot of information to cover today, and a huge thanks to everybody who's already submitted questions for us to ask. We'll be taking all questions at the end of today's webinar so that all of our speakers can first get through their content. We definitely encourage anyone to please submit any additional questions using the Q&A box that's located in the Zoom control panel. For those joining via Facebook Live, we'll also be monitoring the comments in the sections there and be rolling those up as well. I also want to mention to all attendees that this is a recorded broadcast. Today's webinar will be available and will be shared following today's session. I'd now like to turn it over to Dr. Stephen Lieberman. Dr. Stephen Lieberman serves as the Principal Deputy Undersecretary for Health at the VA. He has more than 25 years of experience with VHA, working at both the central office level as well as at VA hospitals in Massachusetts and New Jersey. Dr. Lieberman, I'll now turn it over to you for a brief welcome.
Hello, everyone, and thank you for joining us for today's session. I've been honored to participate in this series of webinars, and I thank the Elizabeth Dole Foundation again for the wonderful partnership we share in supporting our nation's veterans and their caregivers. It has been 1 year since COVID-19 emerged as the greatest public health crisis of our lifetimes. I'm sure it has been an extra challenging year for all of you listening in today. I want to particularly thank our caregivers for all you have done to ensure the safety and well-being of the veterans you have cared for during the pandemic. In healthcare, we are hopeful that with the increasing availability of vaccine and their administration to the citizens of this country, that during 2021, we will be able to see a continued decrease in the toll that this pandemic has taken on our lives, and that we will start to return to some normalcy. The good news is that over the past month, the number of those testing positive for COVID-19 and those getting hospitalized for COVID-19 in both VA and across this country has markedly been decreasing. I thank our more than 380,000 health administration workers in the VA, including the more than 80,000 new staff we have hired since the beginning of the pandemic, who have worked tirelessly and heroically to provide world-class care each and every day. Today, I will provide you a brief update on our COVID-19 response. VA's preparation and response began last January 2020, 2 months before we saw our first veteran with COVID-19. Since then, we've been moving forward to provide exceptional care to our veterans and support to our caregivers. Safe care is our mission and our continued commitment to you. At VA, we have continued to focus on important infection control measures that make a difference with disease prevention, including requiring everyone at our facilities to wear a face covering, screening all visitors and employees for COVID-19 at the entrances of our campuses, restricting access to visitors and locations at great risk for infections, and offering alternatives to in-person patient appointments, such as video appointments and telephone appointments. While such efforts may be inconvenient, they appear to have saved many lives. I strongly encourage all of you to continue to wear masks or a cloth face covering when you leave your homes, and to physically distance yourself from others by at least 6 feet, even after you receive your vaccines and/or if you have been infected by COVID-19. It is also invaluable to use either hand sanitizer until your hands become dry, or wash your hands with soap and water for at least 20 seconds. Scientific study after study has demonstrated that your risk of COVID-19 infection is reduced with simple efforts such as these. From the very beginning of the pandemic at VA, we have remained available to those who depend on us every day. We have sent over 30 million text messages to veterans and their caregivers to keep them informed with COVID-19 updates, including about our COVID-19 frequently asked questions page. If you want to also find this page, a link can be found near the top of the VA's website. And let me give that to you. It's www.va.gov, G-O-V, www.va.gov. And if you go to the top of that webpage, you will see a link to frequently asked questions about COVID. We also committed ourselves to testing and have completed over 1.3 million tests over the past year. We've also made tremendous strides in virtual care delivery, which has helped keep veterans, caregivers, and our employees safer. Since the beginning of the pandemic, VA has increased video appointments to home and other locations of the veteran's choosing by 1,400%. We are so proud of our COVID-19 vaccination efforts to date and how rapidly our program has expanded since we administered our first vaccine to a 96-year-old female World War II veteran at the Bedford VA facility on December 14th. After just 2 months, we vaccinated our millionth individual. This just happened yesterday. As vaccine supplies to VA continues to increase, VA stands ready to further expand the pace at which we will administer vaccines. I cannot urge you enough to accept the vaccine as soon as it is available to you. As you will learn from Dr. Kim, it has been well tested, and that testing has demonstrated the vaccine is effective and safe. Furthermore, it is the only way for us to get closer to that normalcy in life that I previously mentioned. So please say yes to receiving the vaccine. In conclusion, while we are not fully past the pandemic, we are at a much better place now than we have been, and I have much optimism for our future. I appreciate your time today, and to the caregivers out there, thank you for your dedication to caring for our nation's veterans. It is now my pleasure to turn the presentation over to my wonderful colleague, Dr. Jane Kim, our Chief Consultant for Preventive Medicine in the Veterans Health Administration, whom is also our national leader over VA's COVID vaccination program. Thank you.
Thank you, Dr. Lieberman. And thank you everyone for having me on today to talk about what I know is a hot topic in this country is COVID vaccines. I will give you an overview of COVID vaccines and also what VA is doing specifically to roll these out to our veterans and our caregivers in our program. And then I will hand it over to my colleague, Ms. Jill DeBoer, to tell you a little bit more about the caregivers vaccination benefit. So if we could go to the next slide. So I will just pull back a little bit to the fall of 2020. I know for many of us that seems like years ago, but it was really only less than 6 months ago before we had any COVID vaccine and we were just coming out of the summer into fall. That is when VA started planning alongside the CDC to be ready for administering COVID vaccines to our veterans and staff when a vaccine became available. So this slide just shows you that it was a tremendous amount of work to pull together national experts, as well as many people who work in our VA facilities, as well as get input from our veterans to inform us in how we could best roll out COVID vaccines to our whole population when they became authorized by FDA. So what we did is gather all these people together in the fall to start planning. What we did is worked hand in hand with the leaders at each VA medical center and in each clinic to prepare together. And so what we did in the fall is go ahead and ask each of our facilities to do a tabletop exercise, which really is an exercise to start thinking through and planning on how to do COVID vaccination. And I'll go into why we needed to plan, especially for this vaccination in a bit. But I will say as a key, and this is in the middle of the slide, communication was critical. These vaccines are like none other that we have ever had. And the situation in which we were receiving them is like none other that any of us have ever lived through. So as a result, we communicated frequently and often about all the specific things that we expected to happen when vaccines became available to our staff and our veterans and our patients, as well as the public. So in terms of where we are today, we are very proud that after 2 COVID vaccines, the ones by Pfizer-BioNTech and Moderna, were authorized by FDA in December 2020. We quickly rolled out vaccination to all of our regions and today are standing at more than 250 sites offering COVID vaccines throughout our network of care. We have started and continue to vaccinate our critical employees first, as they are our top priority to keep our healthcare system safe and functioning to care for our veterans. And I'm just thrilled that pushing on 66% of our essential employees have been vaccinated to date, not even 2 months after the launch of vaccination. We are now on to 2nd doses of vaccine for those employees and started vaccination of our highest risk veterans as well in December and are continuing to vaccinate more and more veterans throughout the month of January and into February. I'm just also thrilled to say that we are also partnering with our colleagues at the Department of Homeland Security to offer vaccination to their mission critical location dependent personnel who are serving us and keeping us safe on the front lines. We continue to monitor vaccine safety as these vaccines roll out and have a very robust safety program in VA. So everyone who receives a vaccine from us can be assured that there is a network around them to monitor and also address any side effects or safety concerns that come up. And what's on the horizon are that there are hopefully 2 more vaccines to come our way this spring, one from the Janssen company, and we hope that may be authorized by FDA in late February. And the other one is from the Oxford AstraZeneca partnership, which we are hopeful may be authorized in March. So stay tuned and more to come with those 2. Next slide. As many of us know, there are 2 vaccines out currently and available. One is made by Pfizer and the other one by Moderna. And this slide is just meant to show you some high points about them and what made us need to plan with all those people in the fall. They are both 2-dose vaccines, which is really not uncommon for a vaccine series, but the the intervals between vaccines is slightly different, so it's important to get that right. I will note that the Pfizer vaccine needs an ultra cold freezer. So that is dry ice territory. That is not a requirement we've had for really any other vaccine in the past. And so we needed to specially plan for that by buying freezers and making sure everyone who handled the vaccine knew specifically what was required to make sure the vaccine stayed viable. Both vaccines had very specific handling requirements. They can't just be drawn up in a syringe and left there. So that was also a need for our staff to know those special requirements. And so around all of these vaccines, we did a lot of planning to make sure that those people in our facilities who had received vaccine knew what was needed to make sure these vaccines were handled and that safety was ensured to make sure that these shots got in arms and gave everyone good protection. Next slide. So one thing I wanted to highlight is that for the veterans in our audience, people were asking, how do I stay informed on where VA is with COVID vaccination? And so as Dr. Lieberman mentioned, there is a website on our va.gov website, which actually specifically talks about COVID vaccines and answers a lot of questions that you may have in general about COVID vaccines, as well as what's going on in VA. And on that page, there is a tool called Keep Me Informed. It's like a form where you sign up for things, but here you're signing up to keep informed about VA's COVID vaccine rollout. What it does, if you're a veteran who gets care with us, it is also directly links to your facility. So if the facility where you receive care is the place where you want to get vaccination, they get your name and your information, and when it's your turn, they can reach out to you. So I am just thrilled that more than 500,000 veterans have responded to the Keep Me Informed tool to receive updates and to let us know if they're interested in vaccine or if they want to just stay informed and wait and see what happens. So this is a great way to stay informed, not only just in terms of general information, but if you're a veteran who receives care with us, to sign up and let us know that you're interested. So with that, I'll turn it over to my colleague, Ms. Jill DeBoard, to tell you more about the caregivers. Jill?
Thank you, Dr. Kim. Really appreciate it. Sorry that my video is for some reason not working right now, but I really appreciate the opportunity to meet with everyone and share some very exciting news for the Caregiver Support Program. As many of you probably know, on January 12th, our executive in charge, Dr. Stone, did sign a memo extending COVID-19 testing and vaccinations to primary and secondary caregivers in the program of comprehensive assistance for family caregivers. So what does that mean? It means that in earnest, we began working with our staff in the field and with our vaccine coordinators, making sure that the program managers at each of the facilities could download the names of the veterans and their primary and secondary caregivers from our Karma, our IT platform, provide that to the vaccine coordinators. We sent letters to our caregivers to let them know about their eligibility through PCAFC and began providing vaccinations. So it's been a really exciting time. We've already provided over 1,000 vaccinations to primary and secondary caregivers in our program. So at each facility, based upon their resources and vaccine availability, what the needs are there, that dictates when the veterans are contacted to be told that they have a vaccine ready for them. Then the next step would be that the caregivers are also scheduled at that same time. Our goal through this whole process has been to reduce the stress on the caregivers, allowing them to receive the vaccination at the same time as their veterans, as well as to provide the additional support and protection to the veterans. If you have questions and you're in PCAFC, please contact your caregiver support program locally. The National Caregiver Support Line does not schedule or approve the vaccinations, so it really is your caregiver support coordinator that you should be contacting. Also, it's eligible caregivers that are approved in primary in the caregiver support program in PCAFC that are eligible for the vaccination at this time. All other caregivers, we really want you to get the vaccine at your earliest availability. So we would just ask that you work through your state health officials or whatever mechanism you can get to get the vaccine as soon as possible. Next slide, please. Here we're just going into the eligibility for PCAFC, walking through who is eligible, because if you meet this criteria and you're not currently in this program, we would really strongly recommend that you apply. We would love to be able to provide this service to you. The first requirement is that you're a veteran or a member of the armed forces undergoing a medical discharge from the armed forces. If you meet that criteria, the second criteria is that you had a serious injury that you incurred or aggravated in the line of duty in active military, naval, or air service on or after September 11th of 2001, and then beginning October 1st, 2020, when we expanded our program, on or before May 7th, 1975, or after September 11th, 2001. Beginning October 1st of 2022, we will be extending PCAFC to service members, veterans of all service periods. The third requirement is that the individual is in need of personal care services for a minimum of 6 continuous months based on one of the two following: either their inability to perform an activity of daily living or their need for supervision, protection, or instruction. Next slide, please. Then we have 4 more criteria. It is in the best interest of the individual to participate in the program. Next, that their personal care services would be provided by the family caregiver, will not be simultaneously and regularly provided by or through another individual. So they have to be providing their care separate from someone else providing it. Requirement 6 is that the individual receives care at home or will do so if the VA designates a family caregiver. And the 7th is the requirement that the individual receives ongoing care from a primary care team or will do so if a primary caregiver is designated. Next slide, please. Thank you. So these are just some links to resources. The first one is for our fact sheets, one of which you can see to the right. Then the online VA Form 1010CG, which is part of the expansion that started on 10/1 of 2020. You can now get this online. You can apply online, and it's been really very successful. Just under 70% of all applicants now do apply online. Or you can print the 1010CG and turn it in to HEC, her Health Eligibility Center, or to your local caregiver support coordinator. And that's all we have for right now on PCAFC eligibility. Turn it back over to you, Rashi, probably.
Terrific. Thank you so much. So we have a ton of questions that I'm going to start tackling. One thing that's come in is just questions about where can I access the slides and all of that. We're going to be posting all of this to our website later this afternoon. Everyone who's registered will get an email directing folks to the website itself, and then also a copy of the slides. So don't worry, we'll be making sure that you guys get this information. Dr. Kim, one question that's come in from a few different folks, and I think you referenced this a bit with the engagement tool, but a lot of people are saying, you know, I'm currently in a different state, or I'm traveling from the VA that I usually receive care. Do I have to be a resident of the VAMC, resident of the state of the VAMC to be able to get the vaccine locally? Am I only eligible to get the vaccine at my home VA? I'm wondering if you can comment a little bit about that.
Sure, that's a great question, and probably timely, as we have a good number of what we call snowbirds in our system who live in the north when it's cooler in the summer, but then go to warmer climates and live there during the winter. Or you might be traveling or temporarily located in another state just for whatever reason due to work or family. So the answer to that question is no, you don't have to be a resident in the state where you receive vaccine. If you are traveling, I think the best thing to do is to go to the VA that you would like to receive vaccine from and go ahead and let them know either through call or email that you are there and you would like to get into the system and that you like a COVID vaccine. So you do need to make contact with them so that they know you're there. But if you are in our system and receiving care, but you're not near your home facility, you can certainly receive care elsewhere. The only thing that I recommend to people, because the vaccines supply is closely tied to each medical center where the vaccine is received, that you should get your first and second dose at the same location as much as possible. That's because if you receive your first dose at a hospital, they will have your second dose coming for you. If you say go back home to your home facility, they may or may not have that dose ready for you because the second dose gets sent to the same place where the first dose did. So I just ask you kind of think about timing if you're a veteran, and if you're elsewhere, think about whether you can be around in the 3 and 4 weeks after you get your first dose to make sure you get your second dose at the same place.
Great, thank you. Jill, we have a question for you about caregiver vaccination. This came in, so a caregiver asked, my veteran got his vaccine through a non-VA primary care provider, but I am enrolled in the PCAFC program through VA. How should I go about scheduling my appointment?
Okay, so the caregiver received theirs through non-VA, but the veteran, him or herself, is wanting to schedule theirs?
The opposite. So the veteran got their vaccine.
Okay, gotcha.
Yeah,
Okay, got it. Okay, so they can still receive it at the VA. They would just need to contact the VA. They can contact their caregiver support coordinator or the vaccine coordinator, let them know their name and that they are a primary or secondary caregiver of a veteran, and that they are needing the vaccine, and they can get it. Ideally, we want them to be able to have one-stop shopping and be able to do it at the same time, but certainly we want them to get it regardless. So they would still be eligible.
Great. Dr. Lieberman, one question for you that came in, and it's kind of bigger picture. When do you think VA will be able to vaccinate all veterans?
Well, actually, I think Dr. Kim can answer that question even better than me. And but it really depends on the vaccine supply, which is expected to start to increase. It's already been increasing, but we expect it to increase even further. Dr. Kim, do you want to add anything?
I totally agree with that. I think our VA facilities are vaccinating at a high rate. I think our limitation is supply, and that is not just, for VA, that is throughout our country. So we would love to be able to open up vaccination widely, but the main limitation for our country and certainly for VA is supply. I think the good news is that vaccine supply is supposed to increase quite dramatically this year, even by summertime. But until we see those increases and get them at our facilities, we are going to, give vaccine as much as we can out of the supply that we have. So I think the timeline does depend on supply.
Great. Dr. Kim, since I have you, we got another question with people just talking about reactions they've had to other vaccines. So one person said, I've had a severe reaction to other kinds of vaccines. Is COVID-19 safe for me, or what should I do to figure out if it is?
Yeah, that's a great question. And, I think my advice is to speak with your provider first to just discuss your particular situation and the reaction you had to the other vaccine. And the reason I say that is because it is possible to get the COVID vaccine, even if you've had a severe reaction to another vaccine. But it really depends on what that reaction was and how bad it was, and what your provider recommends in light of that information. So I just tell people, why don't you discuss with your provider, especially if you had a very severe reaction, if you should get the COVID vaccine, because it still can be safe, but you may just need extra time to be monitored. I will say for kind of less severe reactions, like you felt really sick after a vaccine, but it was like you had a cold, that is not a reason to not get the vaccine. But if it was really something unusual and severe, or you just have questions, I just encourage people to talk to their provider first about it.
Great. Jill, this question came in from a few different folks, and I'm just going to sort of paraphrase it. I am in the process of applying or being reviewed for the PCAFC program. Will I be allowed to receive the vaccine at the same time that the veteran I support does, or should I wait for my full approval into the program?
Sure, Rashi, really good question. Right now, we only have the legal authority to offer it to those caregivers once they're approved for the program of comprehensive assistance. So even if their veterans have already received it, we have to wait until they are approved in the program to provide it. That's the legal authority we have at this point.
Okay, Dr. Kim, I am registered for care at the VA, but I haven't used their services for a few years. Will I still be called for a COVID vaccine? Am I still eligible to receive it?
Yeah, so I think this question is about whether, you're in the system. It sounds like the veteran is in the system, but they just haven't used it for a while and are wondering if we'll know that they are still active. I'd say call the facility and ask them. I think most of the time, especially with the pandemic, we do keep people on the rolls, as it were, because especially with the pandemic, a lot of people didn't come in routinely just because it just didn't feel safe for a while. But I would say just reach out and see. And if you're not sure, make sure that you are on the list at the facility. And if you're not, let them know that you're interested. So I would just advise people to reach out and make sure, especially if you do want to get in line for COVID vaccines at the VA, that we know that you're there.
Great. We got this a few different times. And it seems a little bit about communication from VA across the different facilities. So the question was, the website is mentioning that it's following the CDC risk criteria, but some folks are saying that their local VA is giving guidance based off of the state guidelines, and the states obviously have something a little bit different, because from state to state, there's variation. What do you recommend people be using to track when they'll be eligible?
This is Jane. I'll take that question. So I will say that the CDC did put out recommendations for who should receive vaccine initially while we have a limited supply. And they base those recommendations on risk and who is at, who has an increased risk for getting severe COVID and being in the hospital or even dying from COVID. They recommended that those individuals be offered vaccine first. That CDC recommendation is the basis for VA's way that we're allocating vaccine currently, and is really the foundation for many states' plans as well. Now, there are differences, and states and even VA have ability to kind of flex and customize CDC's recommendations to make sure that we're accounting for local factors to our local population. So I will say those things as background to say that there are probably similarities between what your state is doing and VA, but certainly it may seem different as well. And I will say for people who are curious about how your VA is offering COVID vaccines, to just look on your facility's webpage or social media to find out, and they should have up there which kind of risk group they're offering vaccine to currently. It should kind of generally align to what a state is doing, but not always. As I said, it depends on supply, also demand, and where the facility and or state is and being able to offer vaccine to various risk groups. So I encourage people to check their local facility website or social media, or call and just ask.
Got it. Jill, we have a question coming in. The question is, thank you so much for providing information on the PAFC program. What are the other benefits of joining this program? And does VA offer any other services for family caregivers who may be impacted by COVID-19?
Oh, wow, that's a really good question. Okay, so the program of comprehensive assistance is, as you could tell from the criteria I went through, it's defined by inability to perform certain activities of daily living, certain diagnoses, and then service connection and areas of service. Whereas our program of general caregiver support services offers a whole menu of opportunities and supports for caregivers, from peer mentoring to education and support and counseling. There's just a lot that is available through VA for caregivers, both through the general program and through the comprehensive program. So if you are eligible for the comprehensive program and you think that it would be of benefit, we just really would encourage you to apply. But all caregivers are eligible to apply if through the general program. And so we would really encourage them to reach out to their caregiver support program at their local facilities to look into those options.
Terrific. And I would also plug the Elizabeth Dole Foundation has launched a respite relief program. We actually have a slide on it that we'll be showing at the end. This is a free opportunity for caregivers to be able to apply to access respite relief. All you have to do is go to our website, fill out a quick application, and we can get you connected with free professional caregiving services. So if you've just been, under a grind for the last few months and need some extra help around the home, be it housekeeping or meal prep or transportation, mobility help, please check that out. And we want to make sure that we're connecting you with that availability. Dr. Kim, we have another question for you. Will CBOCs, community-based outpatient clinics, will they also be providing vaccines, or is it just the main VA medical centers?
Yeah, that's a great question, because many of our patients receive care primarily from the CBOC, which is our kind of clinic side of care, and really might not go to the main medical center or hospital for anything much except for their special visits or if they get sick, very ill. So yes, we do have vaccine at many of our community-based outpatient clinics. Many of those sites that I mentioned in the 250 plus number are CBOCs. Not all of them have it, however. These vaccines, as I mentioned before, have very special handling requirements. So each place where we send the vaccine needs to have the ability to store the vaccine safely in an ultra cold freezer or a regular cold freezer, and ability to use the vaccine within the timeframes that are required. So there's just a lot of extra work that needs to be done to store, handle, administer these vaccines, and the places where we send it through our CBOC network have the ability to do that. Now, I am hopeful that if we get additional vaccines authorized by FDA, those two vaccines that I mentioned, the Janssen product, as well as the AstraZeneca product, are both refrigerated vaccines, which is a huge plus in terms of storage. A lot of places, including clinics, have a refrigerator that's temperature monitored, but may not have a freezer. So if we get those products available, that will provide many more options, and I hope we'll provide more options at more CBOCs throughout our network once those hopefully become available.
And we've also had a couple questions about just, and you mentioned it, just vaccine safety. One person said, I've heard there's been a lot of unreported deaths as a result of getting the vaccine. Is this true? Where can I go to find factual information?
Right. Yeah, I know people are very concerned with safety. I know the vaccines seem to have been developed very fast, and people are worried that maybe it was too fast to make sure that the vaccines were safe. And I just tell people the vaccines were studied in tens of thousands of people and were found to be safe. There were side effects, so I'm not saying there aren't side effects to these vaccines, but in terms of deaths or serious injury, there were no significant signals for the FDA to not recommend them. They are currently authorized and recommended for use. So I will say that as background. The vaccines were developed rapidly, but that's because the US government did put a lot of support behind them to make sure the process went fast and pretty much fast track them, but without skipping any steps that would be needed for safety or effectiveness evaluation. So what's happening now that the vaccines are out is that they are very closely monitored in terms of safety. We at VA, and also pretty much any site that gives vaccine, is required to report back to CDC and FDA any significant safety issues that happen. Whether related or not, we report them all as they come into us, so including deaths. And deaths in particular are carefully reviewed to determine whether it's possible to know if that was due to the vaccine or due to another cause. So CDC is a good place to go for information about vaccine safety, as well as any updates that they may have from vaccine reports that have come in since the vaccines have been out. I know they did a publication in January to discuss some safety issues that had come up in their evaluation of them, and found that in some there were not very many safety concerns that really rose to high significant, and their conclusion was the vaccine continues to be safe and effective, and that people should take the opportunity to get the vaccine when they have the opportunity.
Great. And while I have you, another question came in. I am registered for VA healthcare, but I use TRICARE. Can I get the vaccine from the VA? And there's been a couple questions about how is VA working with DoD that have come in. So I wonder if you can comment on that. And Dr. Lieberman, if there's anything you want to add to that as well.
Yeah, I can take that question. So if a veteran who receives care with us would like to get vaccine with us, they certainly can. I have many patients who also have TRICARE, but if you get care with us, you can get vaccine with us, bottom line. So I would just say that as kind of a first principle. You can choose to get it through DoD if you'd like. You can choose to get it through your state or your private doctor if you'd like. But certainly if you get health care from us, you can get vaccine from us. So it's really a choice, but certainly you can. So I hope that answers the question that someone was asking. Even if you have other insurance, including TRICARE benefits, you can get vaccine at VA if you're a patient of ours currently.
And just to be clear, it's no charge to the veteran.
Great. Jill, we have a question about caregivers and COVID vaccination. I am not in the PCAFC, but I am a caregiver to my spouse. When can I expect to get the vaccination? And are there any plans for VA to extend the vaccination?
Sure. We've really been looking at this. We want to extend the vaccination and testing to as many people as touch our veterans as possible. At this point, we don't have the authority, but we continue to look at possibilities, ways we can do that in the future.
Great. Just going through our list. Are there going to be mobile clinics for rural veterans? If so, where can I get more information and how will I be able to access, and any other information you can provide to rural veterans?
This is Jane. I'll take a first pass at that, and Dr. Lieberman may have more to add. So certainly I know we've been thinking about our rural veterans ever since we started planning for COVID vaccination. As we know, they live in areas a lot of times where it's challenging to get to a CBOC, like our clinic setting. And those clinics may or may not have the ability to store these vaccines, which require special handling. So I know that there are currently efforts to take, especially one of the vaccines that I mentioned, the Moderna vaccine, out to CBOCs, either to do a mass vaccination event for veterans to take vaccine to them, but because of the handling requirements, just to provide it all at once for first dose and second dose, and or to get freezers to those clinics if they need one to be able to store the vaccine where they are. There are other efforts as well that are going on to fly vaccine out to some remote sites, especially in the kind of Midwest area where it's really hard to get to, but certainly those veterans who are there need to be offered vaccine as well. So there are just a lot of creative efforts going on to get vaccine to our rural veterans. And we know that some veterans are saying, it's okay, we'll drive in. If we can get the vaccine there this week at our main hospital, we'll make the drive. And so they certainly have that option too, if they'd like to drive to the place where we have the vaccine stored to get it quickly. So those are just a couple options that we are kind of putting out there for our rural veterans.
Yeah, we've really are making this a priority to look at all of our options that are available. And I do expect you'll see more vaccine offered in more rural areas. As Dr. Kim mentioned, one of the things that we've just started piloting is doing charter flights and flying our staff and vaccine out. And we actually have done this in a couple of locations in Montana. We're also looking in the very near future, also doing it in Alaska and Idaho at some locations. And hopefully this will continue to be successful and we can roll it out in other rural parts of the country.
That's terrific. Kind of related to that, we got a question, from a veteran who receives VA home care, and they're wondering if, can they be transported to the VA for their vaccination? Is there any sort of transportation benefits that VA is offering for people who need that to be able to get the vaccine?
This is Jane, and I'll speak from my experience as a primary care provider. I think there are certainly options that are up and running during the pandemic to get patients to their appointments, including for COVID vaccination. So I don't know if this veteran has those options available. I know at my facility there are a number of options for people who need help with transportation available and up and running, because we know that people's need for healthcare doesn't stop during a pandemic. So there are safe options available. And I know even for people who have wheelchairs or are need assistance, there's transportation options for them as well. So I think I'd say if you're usually homebound and need assistance getting to VA, I hope there are options for you at your facility to help you get to your facility or clinic if you'd like a vaccination.
And also, if I could just add, Dr. Kim is correct. Many of our VAs are looking at, can they provide vaccine in the homes? I think it depends on what type of vaccine that they have available and how stable that vaccine is. So hopefully, if those other vaccines get approved soon, that may create other options where it's easier for your home-based primary care team to actually bring it to your home. But if you can get it sooner, I would just encourage you not to wait and just find a way. And hopefully you can work with your VA and figure out how you can get transport to wherever they're giving the vaccine.
Terrific. We got one question. What do you recommend for a husband and wife who are both veterans over 70 for getting their vaccines? Should they receive the vaccines together? Do you recommend getting them separate? And I think some of the comments here is, if there's any side effects or things like that, is it better to have, one person wait a couple weeks before getting theirs so that they can sort of help out around the house, or should they just go for it together? Dr. Kim, I think that one might be for you.
Yeah, so this is my opinion, and this is just maybe based on the fact that everyone's response to, products is different. Unless you have exceptional circumstances where you're really worried about a severe effect in one person, just get it together if you're both eligible. And I'd say that because one person may have a side effect and the other person may have none. And these days, it's just hard to get vaccine anywhere. So if you have a turn, I just encourage people to take advantage of it, knowing that there is a chance that both of you might feel bad the next day from a side effect. Your body might be reacting to it. I would hope that both people would not feel terrible after the vaccine. I guess that's also always a possibility. But most side effects we know are short-lived, last a day or two. Some can be, severe enough that they really keep you down in bed like a flu might, but you kind of bounce back pretty quickly. And a lot of side effects are pretty mild, like a sore arm. You might feel a little tired, some muscle aches. I personally was bracing myself for a really bad side effect, but my arm was sore both times for a day, and that was it. So I really lucked out. So, given the kind of various responses you could have, I'd say if people are comfortable with it and you're both eligible, it's fine by me if you both get vaccinated at the same time. And that's really what we're offering to the caregivers in the program, to the ability to do that and get vaccinated at the same time. If you're going to come into VA anyway together and would like to go ahead and get vaccinated together, we're offering that option to do that.
Yeah, and Dr. Kim, on the same sort of thought stream, we got a question about some experts have recommended that I get the first shot and then wait a month or longer before getting the second shot for full sort of efficacy. What do you recommend for this?
Yeah, so I recommend following what the studies did is for Pfizer to wait 3 weeks or 21 days between the first and second dose, and for Moderna to wait 28 days or 4 weeks between the first and second dose. And the reason for that is because that is what the studies studied in tens of thousands of people, and that is what they saw the benefit in, is getting the vaccines those time intervals apart. I think maybe this question may be alluding to the fact that in other countries, they have delayed the second dose in order to get a first dose in as many arms as possible. That is a strategy that other countries are using, but here in the United States, while we have vaccine supply, we are recommending people get the first and second dose as was studied in the trials, because we know from the studies that that's what offers you the full protection.
And I'm going to actually ask a question to Dr. Kim, because I think it'll be helpful to the audience. If I say live in an area and there's a really bad snowstorm and I'm too afraid to drive to get that Pfizer vaccine in 3 weeks and Moderna in 4 weeks, is it okay if I wait a few extra days for the snow to melt before I get that second vaccine dose?
Yes, it is okay to wait. And so there is flexibility in that 21 and 28 days. I know even for convenience reasons, people might not be able to come back exactly at 21 days or 28 days. And so there is a flexibility there built in by the trials and by CDC to say you can come as early as 4 days before that interval, or you can come later. And the later is, to allow for the fact that there are snowstorms, there are life events, there are scheduling issues, maybe other things come up. And so you can get your vaccine up to 6 weeks after the first dose, the second dose 6 weeks after, and still be okay. And even if you end up having a huge delay for whatever reason and can't get the second dose until after 6 weeks, that is okay too. CDC says just give the second dose then and consider it done, and no need to kind of get another dose or restart anything. So there are some flexibilities built in there, given that we are in a pandemic and life happens. You don't have to stick exactly with the 21 and 28 days, but we do encourage people, if you can, to stick as closely to those intervals as possible.
Thank you. Jill, we had, a lot of comments are coming in, and I think people recognize sort of the PCAFC requirement, but a lot of folks are asking, my father-in-law or my grandfather or my mother-in-law is a disabled veteran or an individual with a disability who really needs support of another family member to come in. Is it possible, what should those family members do if they're interested in getting the vaccine? Recognizing PCAFC right now is the requirement. What guidance would you give though to family members that are helping those veterans with disabilities get their vaccination?
Sure. So for non-PCAFC caregivers, for veterans who are severely disabled, just working through the state health department or whatever insurance carrier they have, whatever they can do to get in as soon as possible. We recognize that it is a hardship in some areas to access the vaccine. That's why we feel so fortunate to be able to provide it to the veterans in this program. But yeah, and I would say too, that if they are really struggling with that, to talk to their PACT social workers, this PACT social worker for the veteran or the caregiver support general coordinator, to try to help them, find some resources in the community to help them.
Great. Dr. Kim, we got a couple questions about this. If I get the vaccine, but if I'm exposed to COVID-19, can I still pass it on to others in my family? What is the guidance there?
That is a really smart question. And the answer is we don't know yet. If you get the vaccine, which means 1 and hopefully 2 doses, if you get exposed to COVID, whether you can potentially transmit it to others, even though you fully got vaccinated. So I will say that question is really important. It is being studied right now because it is critical knowledge for us to know, if the vaccine breaks the chain of transmission. So that will be critical for us to know, or also because if it does, that certainly can give us more options to get back to our pre-pandemic life. But for now, we are encouraging people and following CDC's lead on this to continue to mask up, wash your hands and stay a distance, not gather in large crowds until we know more, because certainly if it's unknown, there is a possibility that you could be exposed to COVID and transmit it to others. And we just want to make sure that our communities and our families stay safe. So more to come as we learn more, but for now, the advice is to put your mask back on, as I did after I got my vaccine. And I'm sure we'll be hearing more, and I hope we'll hear more to help us know how the vaccine may affect transmission this year.
Great. Yes, so important to keep those preventive measures up. Will VA, I think Dr. Kim, this one's for you. Will VA be reviewing my medical history before I get the vaccine? Yeah, I think that's the question. Sorry.
Yeah, so I think, there's maybe 2 parts to that. I think when we offer vaccine in this kind of limited phase, one of the phases is to offer vaccine to those who have a medical condition that is known to be a risk for getting severely ill from COVID. So in that case, if you're a veteran who has, say, heart disease or lung disease or diabetes, we would have reviewed the fact that you had that condition in order to be able to reach out to you when it's your turn to offer you vaccine. So I'll say that is the case kind of when we determine when that phase comes that you're eligible. The second part maybe is what this question is more asking is do we do a health history to kind of compare your medical conditions against what we know about the vaccine and whether it's safe for you before we give it. And I will say that we do have some screening questions for everyone who comes in for vaccine to kind of hit the big points that would be showstoppers. So have you had a severe life-threatening allergic reaction to a vaccine or any kind of injectable product before is one of them. So we do a brief health history based on the things that would really make us pause or maybe do something different in monitoring you after the COVID vaccine, so that we make sure that for safety reasons, we're aware of those. But we don't do a complete health history when you come in to kind of get all of your medical history on the table, because it's really not needed for the most part. We really are just wanting to be aware of any severe reactions that might influence whether we give the vaccine or whether we should monitor you for longer after you get it.
Great. I know we're nearing the end, so we only have a couple questions left, and appreciate everyone's patience. I know we've been inundated with really great questions. I'm trying to do my best to have all my screens open. Are there, you mentioned sort of the brief history that they'll do right before vaccination. A lot of people in our community are supporting veterans with traumatic brain injury. So one of the questions we've seen is, are there any specific side effects for veterans with severe TBI?
Not specific to veterans with severe TBI. I think the main things that we want to be alert for is if people have had, as I said, a very severe allergic reaction to a vaccine or other injectable, or any other kind of severe allergic reaction, because that maybe puts you at more risk for getting one after the COVID vaccine. Although it's not a reason not to get it, it might be a reason to kind of think through it some more. But for TBI, no. In fact, I would say that a lot of those veterans probably have other health risks because of their brain injury and should probably get vaccinated to make sure that they're protected.
Great. Dr. Kim, and this might be a good sort of, for people who might have missed it at the beginning of the presentation, a good way to circle back and plug some of the tools. But a couple questions are, if I'm a veteran, but I have never gotten care at the VA, I've never accessed my VA benefits, is it possible for me to receive a vaccination at the VA?
Yeah, I think I mentioned at the beginning there on the VA main webpage, which is www.va.gov. Right at the top, there's a banner, learn more about COVID vaccines, and you can click on that. And that's where you can sign up for a Keep Me Informed email or kind of set of emails to pretty much stay tuned about and in the know about what's going on at VA with COVID vaccines. Right on that page, there's a place to apply for VA benefits as well. And I can even find it. It is so well laid out and easy to use. So if you're not currently receiving VA healthcare, but are curious and would like to apply, you can do it right on that same page. And I think the response time, I went through it and looked to see how long it took, and it doesn't take that long to get a response. So I encourage people, if they are interested in getting a COVID vaccine with us, but don't know if they're eligible for VA healthcare, to go ahead and apply. And I hope you'll get a response pretty quickly. There's even a number to call if you're not sure and want to check. So just encourage people to go to that website to check it out and apply if you'd like.
Terrific. So I know that we are towards the end of our time. I want to thank so much our colleagues at the VA, Jill DeBoer, Dr. Jane Kim, Dr. Stephen Lieberman, for taking the time to answer all these questions. I know I felt like I was really throwing them at you really quickly. What we will be doing is following today's presentation, we'll be posting this to YouTube. Encourage you to rewatch, to share with anyone in your network that you think can benefit from this information. We're also going to be pulling together sort of a summary document that outlines some of the questions and the common themes of what we heard today. And we'll be posting all of that to our website. For all of those that registered, you will be getting an email with the slides, the summary document, everything, so that you can review it. I want to just quickly mention that we also have our respite program. I mentioned it a little bit earlier. For any family, any veteran or military family that's in need, that needs a little bit of extra help, the EDF set this program up with our partners at CareLinks, and we're able to offer free respite care services within your home to veterans who are eligible. The program is available nationwide. So please visit our website or send us an email if you have any questions. Also encourage you to register at hiddenheroes.org so you can access a full range of different programs available to military and veteran caregivers. And with that, I want to thank everybody so much for participating today and look forward to our next Spotlight Series episode. Have a good afternoon.
So much.